There are two types of patients that come to me. One is the patient who has a pain in their back or in their leg, in their arm or in their neck that hasn't gone away like those kinds of pains had in the past. The second kind of patient is the patient who comes after months or weeks of physical therapy who still hasn't gotten better. I think the most common comment that I'll hear from patients before they have had back surgery is some description of a relative or a friend who has had back surgery, usually in the past, greater than 5 to 10 years ago, who had to suffer a lot, who had a very long recovery, and who may not have gotten a lot better. The biggest misconception is that in the last 5 to 10 years the technology hasn't changed much, and I think it has. It's changed very, very drastically and significantly. The idea of minimally invasive approaches to surgical procedures has swept the field. For example, a microdiscectomy, which used to involve a day in the hospital, now is an outpatient procedure. It is done through an incision about this big, and the patient goes home the same day and usually has relief of his symptoms that same day. We are starting to see younger and younger patients. We attempt spine surgery for them, whether it be a minimally invasive fusion or a minimally invasive microdiscectomy or a neck fusion, something like that, so that they don't have to compromise their activities later in life. And through the development of minimally invasive approaches, these younger patients are able to be helped with a minimal impact to their lives and a minimal amount of surgery.